And welcome to my channel 5 Minute Pediatric. Today we will approach to the stridor in pediatric patient. Okay, so stridor is noisy breathing and mainly occur due to airway obstruction. So we have three condition. If a common three condition. So if a child comes with a stridor, okay, and it is intermittent, and the age group is usually infant. Okay, if the child or if the infant comes with intermittent stridor and no other complaint, the child is active, playful, so this is typical of laryngomalacia. So we have some mnemonics for laryngomalacia. So here we have prone. P for popular I have made. So this is the most common cause of congenital abnormality of larynx, and it is one of the most common cause of stridor in children. Okay, it resolved spontaneously. Okay, it usually 1 to 2 year the child becomes symptom free, and the symptom relieved in prone position. Okay, and we get omega sapid epiglottis. Okay, and for noisy breathing and E, here we have the symptoms get exaggerated during crying, supine, and feeding. Okay, this is about laryngomalacia. You can easily remember the mnemonics prone, and the child get feels better in prone position. So again we have a child with a stridor, but now he has history of upper respiratory tract infection. He has history of fever, cough coryza, okay, and the child has barking cough. This is typical history of croup, acute bronchitis. Okay. Uh, Now we have mnemonics for croup. I have made mnemonic same group. C for corticosteroid. So the child get benefit after giving cortico. If we give oral dexamethasone, single dose 0.6 milligram per kg, or we can give oral prednisolone. So this is preferred. This is less effective. And R, we have racemic mixture of adrenaline. This also gives benefit. O for oxygen helium mixture, what we call heliox. U for URTI infection, upper respiratory tract infection. And P for para-influenza virus. This question is commonly asked. What is the common causating organism of croup? So para-influenza mostly cause croup. Other virus we have adenovirus, we have rhinovirus. Okay, extra. Now we have third condition again of a child with a stridor. Now the child has sudden onset stridor with fever, dysphagia, drooling of saliva, and the child is having toxic look. Okay, the child may have severe respiratory distress. Okay, this is this condition what we call acute epiglottitis. Questions are frequently asked related to acute epiglottitis. So what is the causative organism? Here we have H. influenzae. So please do not get confused between parainfluenza and H. influenzae. Parainfluenza causes croup, and acute epiglottitis is caused by H. influenzae. This is bacteria and this is viral. Okay, most of the people get confused between these two conditions. So H. influenzae cause acute epiglottitis. Okay, and the child, if we get X-ray, we may get thumb sign or vallecula sign. In croup, we get stipple sign. Here we have third generation cephalosporin antibiotic. Third generation cephalosporin is drug of choice. Here antibiotic has no role. So you can differentiate these two conditions. Hope you enjoyed this video. Kindly like, subscribe, and follow my channel. Thanks for watching.